Welcome to my medication overview video where I go over all the medicine that you should plan on taking during your transfer cycle. If you've already been through the egg retrieval, you'll notice that all the medicine is actually the same. So that can be comforting to know that there won't be maybe any real big surprises with the transfer cycle. All right, getting started with the first one that you'll probably be asked to take is letrozole. Letrozole is an oral tablet that you will be taking for 5 days. Mine started on day 3. You should expect to start that medication on either days 3, 4, or 5. So if you have your period, day 1, just 2 days later, you will probably be starting this medication, or at least within the first 5 days. The next medication you should plan on taking is called Gonal F. It's also called Follistim, so you'd be maybe prescribed either one. Gonal F is a refrigerated medicine, so make sure you put it in the refrigerator as soon as you get it. This is, like I said, an injection medication. It comes in a pen form. There's a little box here that has 0 on it. That's where you're going to be doing your dose. So that'll be based on what your provider tells you. This comes in a pen. You take off the cap, you put on your needle, and you would inject this into your belly. So a subcutaneous injection is one that just goes right under the skin. It's supposed to be kind of the smallest needle that you would ever use for an injection. So it's kind of a good warm-up, I guess, to do injections on yourself if you're doing that for the first time. So what Gonal F is supposed to do, from what I understand, is it stimulates the growth of your eggs. So as you have your monitoring appointments, they're going to be measuring the size of your egg follicles. And given that, they might alter or adjust your dose based on what they're seeing with your growth. So this one starts relatively early in your cycle. For me, this will be starting on day 5 of my cycle, so just 2 days after letrozole. So for a little bit of time, I'll be taking the letrozole and the Gonal F at the same time. Okay, the next medication you might be asked to take is called Ganirelix. Ganirelix, it comes in these individual syringes in a box like this. And these are pre-filled syringes. So this is another injection medication. This one is a little simpler than Gonal F just because it doesn't need to be refrigerated and you don't have to measure anything. These are all measured for you in these pre-filled syringes. It has a needle that's included as well. So you just have to take off the cap and inject. Ganirelix is also a subcutaneous injection. So you'll be doing that in your stomach. And it'll be like a smaller needle. So the subcutaneous ones the needle is 1/2 inch long, just to kind of give you an idea of what that looks like. So Ganirelix, the purpose of this, from what I've been told, is that it prevents your body from ovulating. So in a natural cycle, during those first 2 weeks, your body is actually developing and growing one of your eggs. With the Gonal F, I think that multiple eggs will be growing and developing. But in a natural cycle, once your egg reaches a certain point, like whether in size or in development, it will trigger your ovulation to happen where it releases that egg. Depending on whether you're having the transfer or egg retrieval, your provider might not want you to ovulate, until they're ready for you. So this Ganirelix allows your eggs to keep growing, but not ovulate. So in the past, I've been prescribed this to start sometime after the Gonal F, and I usually take it on a daily basis. So at some point in your cycle, you might be taking the Ganirelix and the Gonal F at the same time. Okay, the next medication is probably the scariest one. It is called Pregnyl. Comes in a little box like this. Pregnyl is the scariest one for me because the shot is an intramuscular shot, which means the needle is very big. You're aiming for your muscle, not just under the skin. So this needle is 1.5 inches. It's 3 times the size as the previous 2 injections. But the good news is that you only need to take this one once. Okay, so it'll just be like one night where you'll have to take this. So in this box, so here's the syringe and the needle. In this box comes 2 vials. There's going to be a saline solution and powder. The powdery stuff is your medicine. The saline solution is going to be what you're mixing it with so that you can actually inject yourself. So you will be preparing this one yourself. You'll be filling the syringe, and then you actually get an additional needle where you will switch these out. So once you prepare the syringe with this needle, you will then switch the needles so that you have your injection needle on there instead. Just a reminder, I do have separate videos for all of these injections so that you can see how I prepare them and also how the injection actually looks. Again, it'll just be how I do it, but it might be nice to just kind of see how someone else does it, especially with this Pregnal. In that video, I give some tips as to what I've done to make it a lot easier. So, okay, what Pregnal does, I forgot to talk about that. What Pregnal does is this actually triggers your body to ovulate. So when you're ready to go into the egg retrieval or when you're ready for your transfer, this medication will trigger your body to ovulate, and you will stop all other medicine once you take this. So you won't be taking the Gonal F, you won't be taking the Ganirelix. This will be the last medication you take before your transfer. Okay, the last medicine I'm going to talk about is called endometrin. So this is basically this is a progesterone supplement, and this comes in the form of a vaginal insert. So this you will be actually, it's not an injection, but you won't take it by mouth, you'll take it the other way. So very interesting because I never had done this before, but it's actually a lot easier than it might seem. So with the endometrin, you will be asked to take this sometime after your trigger shot and before your transfer. So what this does is, it's progesterone that you're putting into your body. What progesterone does is it continues to thicken your lining in a way that will allow an embryo to attach, and then not only attach, but be able to stay attached and grow into a baby. So they typically prescribe the endometrin a couple of days after you do your trigger shot. And ideally, it'll be a few days before you actually do your transfer. So once you take your trigger shot, the other injections stop, but then you will be taking this progesterone supplement to make sure your lining is ready for that embryo to attach once they put it in. Now, the endometrin is one that you should expect to take 2 or 3 times a day. So a typical dose is 200 milligrams per dose. These come in 100 milligram tablets. So in the past, I've been instructed to take this 2 of these tablets 2 to 3 times a day. So I don't know what this cycle will look like. I don't know what you'll be prescribed, but it's the same idea. I do have an extra video for this one to show you like what's in the box and how you do it, but I will not be showing me actually inserting it. I'll give enough information so you'll be able to do that on your own. All right, lastly, that's all the medication, but you do get, with all your medicine, you do get like a set of alcohol swabs, some gauze. You also get a little sharps container to keep all your needles in once you've used them. So that is everything. That's what you should expect when you go into a transfer cycle. Again, I very much recommend filling all of this medicine as soon as possible so you have it all on hand and you can get it organized before starting anything. All right, please check out all of the individual videos I have for each of these medications as it's relevant to you, and I will see you in one of my next videos. Thank you for watching.